Alrighty, so this is a presentation for the community health assignment, and the topic that I chose is caring for a patient with severe dementia. So just a quick introduction of what this presentation will be on. What is dementia, the etiology, clinical manifestations, screening tools, nursing management, and expected outcomes. Dementia is a neurocognitive disorder that's characterized by loss of memory, language, judgment, reasoning, and orientation. Agitation, hallucinations, and delusions are also common. These personality changes can inhibit the individual's ability to perform activities of daily living and fulfill social and family responsibilities. 15% of older Americans have dementia. In the United States, about half of all patients in long-term care facilities have dementia or Alzheimer's. So for the etiology, dementia is caused by both treatable and untreatable conditions. With prolonged exposure or disease, irreversible changes may occur. The most common causes of dementia are neurodegenerative diseases, and the majority of those are Alzheimer's, and vascular conditions are the second most common cause of dementia. Additional causes of dementia include medications, infections, urinary retention, constipation, immobility, hypoxia, pain, dehydration, and sleep deprivation. Clinical manifestations, especially for more severe cases, also include memory loss, inattention, disorganized thinking, altered level of consciousness, delusions, personal hygiene deterioration, dysphagia, apraxia, loss of ability to recognize family members, aggression, loss of ability to communicate, and all of these can either be gradual or abrupt. So these are just a few of the screening tools that can be used to assess cognitive impairment. So you have the mini-cog, the memory impairment screen, the general practitioner assessment of cognition, and there's also research that's ongoing for the development of a diagnostic test that can improve recognition of the early stages of dementia. So if you can recognize dementia early, then this could result in better management of the symptoms. So for the nursing care, how does hospitalization affect patients with dementia? Patients with dementia have significantly higher rates of hospital-acquired complications. Some of these include UTIs, pressure injuries, pneumonia, and delirium. When these problems go unrecognized and untreated, they can accelerate the progression of the physical and cognitive decline. So this can lead to nursing home placement or death. To optimize function in hospitalized patients with dementia, nurses should encourage participation in stimulating activities in ADLs while also promoting safe mobility and ensuring that all sensory aids and assistive devices are available and being used. Patients with dementia may have decreased ability to understand information they receive or express information that will help healthcare providers in caring for them. Because of this, effective communication strategies are essential to provide person-centered care to patients with dementia. Nurses should assess the patient's language abilities and communication patterns and try to gather information from the patient's family and caregivers that will help all staff communicate with the patient. So these are just some different strategies for communicating with patients with dementia. So you have verbal strategies, nonverbal strategies, and attention to behavior. So you want to avoid elder speak, you want to introduce yourself, you want to provide choices, and you want to say what you are doing and why to promote smooth transitions in between activities. You always want to approach the patient from the front and at eye level, and you want to use a gentle and calm manner to get the patient's attention or to transition from one activity or another. And you also want to take time to learn what the patient wants or needs while also avoiding triggers that upset or agitate the patient. So safety is a really big issue for patients with dementia. So a patient in the late stages of dementia has increased difficulty with the most basic functions, including walking and talking. So for these patients, total care is required. The patient is at risk for problems related to personal safety hazards, and these include falling, ingesting dangerous substances, wandering, and injuring self or others with sharp objects. To create a safe environment for mobility, environmental hazards must be minimized. The patient should have a brightly lit, clear pathway to the bathroom. The bathroom should be identified with a large print sign or picture to avoid any confusion. So finally, we have some late stage and severe dementia care management. So we have pain management. Due to difficulties communicating verbally, the nurse should rely on other cues such as increased vocalization, withdrawal, or changes in function to assess pain level and to treat the pain accordingly. Swallowing difficulties. So you want to use pureed foods, thickened liquids, and nutritional supplements when chewing and swallowing become problematic. So this will help with avoiding any issues with aspiration. And when oral feeding is not possible, NG tube or PEG tubes may be used. For oral care, in the late stages, the patient is unable to perform oral care. Because of swallowing difficulties, patients may retain food in the mouth. So it's important to inspect the mouth regularly and to provide mouth care. Skin or infection prevention is also a big one. So pneumonia and urinary tract infections are the most common infections and can lead to death. So any manifestations or signs of an infection, including fever, cough, pain during urination, or change in behavior, should be promptly evaluated and intervened. With skincare, it's important to monitor the patient's skin over time. So you want to note and treat rashes, redness, and skin breakdown. Incontinence and immobility can place patient at risk for skin breakdown. So you want to keep the skin dry and clean, and you want to reposition the patient regularly to prevent skin breakdown. And then finally, elimination problems. Urinary and fecal incontinence lead to increased nursing care. So when possible, behavioral retraining, such as scheduled toileting, may help decrease episodes of incontinence. And then the final or expected outcomes for the patient with dementia are to function at the highest level of cognitive ability, to experience no injury, to remain in a restricted area during ambulation and activity, and to perform basic personal care by self or with assistance in cases of severe dementia. And that is the end of my presentation. Thanks for watching.